You can't see anything without your glasses on.
Meet Cindy Webster. She's 47 and has been wearing glasses and contact lenses since she was 10 years old. Today she's visiting with an eye doctor to see about having corrective surgery.
There are a couple different ways of doing it. Number one is a surface treatment called PRK or epi-LASIK. That's not for you. You have too big a prescription to put into your cornea to just do a surface treatment.
Okay.
You need to have LASIK, where we make a flap.
LASIK was developed in 1998. During LASIK, a flap is created in the cornea and lasers correct the patient's vision to 20/20 or better.
But once you get the laser done and you can see 20/20 or better afterwards with no glasses, no contacts, no hassles, no dry eye, no feeling like something's in your eye, you really know what you've got, especially when you wake up in the middle of the night and you can see everything clear.
For Webster, Dr. Woodcock recommends a particular method of LASIK called intralase.
There's a very advanced laser which actually machines out with a laser the corneal flap. And intralase is the new version of LASIK, the blade-free way of making the flap. We put a suction cup on your eye, the laser comes and docks onto your eye, and then a laser machines out the flap. Very precise. It's as precise as any laser cutting you can think of.
The intralase method was developed about 5 years ago. Dr. Woodcock says it's the most technologically advanced form of LASIK.
Probably half the people we're operating on now with the blade-free method, the intralase, the all-laser procedure, about half of them are 2015. 50% are better than 20/20.
It's also the most expensive. At about $2 grand per eye, Webster's surgery won't be cheap. Woodcock says the results of the surgery will last forever, but about 3% of his patients have to come in within a year of their surgery for retouching. The Food and Drug Administration says the level of improved vision you experience after surgery may decrease with age. The American Society of Cataract and Refractive Surgery says about 95% of LASIK patients are satisfied with their results. Complications can include dry eyes, glare, double vision, inflammation, infection, and even blindness.
But things do go wrong, but the chances are extremely remote. I would say even with bladed LASIK, your chance of having any sort of problem is probably about 1 in 1,000.
Webster says the chance to be able to see more clearly is worth the risk.
It's just the freedom of being able to see all the time. You know, not get to just be able to see and not put the glasses on. Be able to watch TV without glasses, see the alarm clock without glasses.
After Webster's appointment with Dr. Woodcock, the next step in her LASIK journey is to go to a place called LaserView.
Okay.
We'll see you back in a week.
Okay.
Before she can have surgery, she first has to undergo a series of tests here at LaserView of Central New York in Liverpool. Here at LaserView, machines gather detailed measurements of her eyes. These measurements help determine Webster's exact prescription. After her eye scan, it's back to Dr. Woodcock's office for one last checkup before she can be cleared for surgery.
There's not too much that bothers me about them. All of your numbers match up perfectly. So you'll have a beautiful procedure. You'll do real well. I think you'll do real well. Yeah.
And with that, Webster has nothing left to do but wait.
I'll see you soon.
Yes, I am looking forward to it. Like I said, I wish it could be tomorrow and it'd be done.
In just a few weeks, she should be able to see the world in a whole new light. While Cindy Webster awaits her surgery date in late March, 21-year-old Amanda Drury will have her surgery in just 2 days. This college student is having a different type of laser eye surgery, photorefractive keratectomy, or PRK. In part 2 of our series, Justin Suddeth will show how this snake breeder
Good morning.
is looking forward to finally having clear vision. Jennifer Brofer, NCC News.